Patients feel better overall. They feel like they're getting more out of their appointment if it's in person versus just a phone call. And it's their time sometimes to socialize. It's the only time if they're getting out and about. So
right, it's to go to the doctors. So that's just as important. Hello and welcome to Senior Life Publications Ask the Expert podcast, where we talk about all things involving healthcare, free finances, resources, and other important senior-related topics. Hi, I'm David Moss, publisher of Senior Life Publication, which is a free resource for you and you can find anywhere throughout the Tampa Bay market.
And I'm Stephen Halstead, sales manager with Senior Life Publications. And here we are. Yay, we're back again. Look at this. We're back. The gang's all back together. And part of our monthly doctor series with Optum Primary Care, we're here at the Bayway Clinic in St. Petersburg with Dr. Ashleyrae Donald. Welcome.
Thank you.
How are you?
I'm good.
It's excited to have you here. Thanks for getting together with us today. So we want to take the time to let you tell a little bit about who you are and what your background is and, how to get in touch with you.
Absolutely. So, like you said, I'm Dr. Ashleyrae Donald. I've been with Optum now since November of 2020. I came from the military, so I was an Army physician for the past almost 8 years.
Wow.
Thank you for your service.
Thank
we
you.
appreciate that very much.
So I decided to leave the military. I had a great time, a lot of experience, a lot of traveling, but Florida is home for me, so I was ready to come back home with my family. So that's what we did, and I decided to go with Optum because I loved the business model and the patient care, and that is what attracted me, to the center. So yeah, I'm very excited.
It's interesting you bring that up because we have talked to the different doctors throughout this year from Optum, and they all pretty much say the same thing. They're like, we're really happy to be a part of this because of the service that it gives to the community. So that's one of the perks of using the Optum facilities. Where do you fall as far as what you think some of the most important issues are with the patients, the clients that you see coming in?
Yeah, absolutely. So for most of our patients that we see here, we see a wide array of disease processes. We see heart failure, COPD, diabetes, high blood pressure, all the way to cancer patients. We see a good portion of HIV positive patients, here in this area. Even some transgender care, we can perform here. So we have such a wide scope of patients and ages and disease processes, and it's really I describe it like your traditional old school primary care, where we really do control, and we're a part of every aspect of the patient's health, and we try to be the liaison between the specialists and hospitalizations and rehab centers.
I think it's amazing that you're sitting here telling us that you're serving such a wide variety of people, and you've mentioned HIV, you've mentioned transgender, you've also just mentioned your general morbidities, but I think that's very brave and very smart of you guys to be able to do that, because we need doctors that serve the whole community, depending on what the community is. So, and you've sort of acclimated to your area, and I appreciate that. So personally, thank you for doing that.
Oh, thank you. You're welcome. And, coming from military medicine, it's definitely been a different setting for me. Very similar in a lot of ways. When I was in the military, mostly I was taking care of veterans and older retirees. So, the over age, 65 population. But then I also took care of young, healthy soldiers. So there was there's this big kind of mix up, of different patients. But, we got a lot of experience, as an internal medicine physician, more experience with, geriatrics and our seniors, and the complex medical problems and social aspects, that go along with their care.
So Dr. Donald, can you go a little bit, and you ended up talking about your experience with the military. How's that kind of come together with what you're now helping with your patients? And go in a little bit more specific on how that's kind of branched those two together, if you don't mind.
Yeah, absolutely. I think with, those of us that have been in the military, we do get a good bit of leadership, skills, and we really focus on being the leader, not only in our clinic, but in our community. And so that to me has kind of translated to, really advocating for the patients and, changing things, even if it's processes that have been done for a long time. What can we kind of change? What can make us more efficient? What can, increase our access to healthcare? Anything that we can kind of improve upon, for the patient. And then just with, the different, I haven't had that experience with the different types of insurance companies. That's probably kind of the big thing that was a learning process for me. But kind of coming from a type of practice where it wasn't, focused on quantity, I wasn't, coming from a profit-driven, company, this was the military, and it's kind of like socialist type of healthcare system. So it kind of got me used to focusing more on the quality and the preventative care for patients, and that's really what we try to focus on here. If we can keep patients healthy, then they'll live longer and they'll have less complications. And really, I think that's where everyone is really focusing on is preventative care and, and treating things early on to prevent some of these long-term complications.
And that's smart too. I mean, that whole bringing that experience in and finding somewhere that you feel like you already kind of fit into that is tremendous. But, we've talked about with some of our past interviews with the doctors from Optum about the different things that we talked about, being in quarantine for so long and the type of things that happened during quarantine where the people weren't necessarily going to the doctor. And one of the things, we've talked about fall prevention and we've talked about mental health, I think is really important because in the middle of all this is a person's mental health, correct? So have you seen, effects of that now that we're sort of coming out of that and getting back into the norm, and maybe people are coming back to see the doctor, not over the internet where you can have your eyes on them, right? Are you seeing some after effects of some of that not being able to leave the home and not be able to socialize, or maybe in some cases not get their meds? I've heard these stories. I mean, it's crazy.
So yes, I have seen a lot of effects from the pandemic, like you were saying. Not only mental health, has been impacted, but also physical health. At the very beginning of the pandemic, I think we were seeing a lot of delayed diagnoses, from patients that were very hesitant to go to their doctor, go to the ER. So anywhere from heart attack to stroke to blood clots. We were seeing, these delays in care more so because of fear of the virus. Some of that has subsided over the many months now that has been going on. So, having people, going back to the ERs now and back, into the offices. And, the thing that I run into every day is more of people's diet and, and exercise has been tremendously impacted for most people who, can't or don't feel comfortable going to the gyms yet. Or those who don't have access to gyms, and just, dietary changes, eating at home more, doesn't always necessarily mean healthier. And so we're seeing quite a bit of patients that have, gained some pandemic weight, and, and that, can secondarily lead to, their diabetes or their high blood pressure or high cholesterol being less well controlled than it was previously. And so getting people back on track, has been a process, and really kind of advocating for, home or outdoor exercise, especially in a location like Florida where, that's possible year round pretty much. But I think the mental effects is something that, we're really seeing a lot, and, it's kind of affecting, I think, people who haven't had any history of any mental health issues in the past. And I think just with social isolation, I think we're bound to see that, to some extent. So we're all hopeful that as more and more people get vaccinated and we start to kind of get back, to some new normal, that some of that we will see improving as well.
Good job.
We talked about preventative medicine before, but we never really talked about preventive mental state. And it seems like that's really starting to, balance each other out, because what I find, or some of the other interviews that we've had with Optum, is that they've talked about preventive medicine, but really the mental part, I'm sure you get a little bit more into it, Dr. Donald, about how to balance not only the physical activity, but also the mental side of it and the isolation, especially a little bit more with, say, seniors that are 65 years and older, who you probably are seeing a lot more now. Can you go a little bit more about some of our viewers who are watching, what kind of things they can do for their mental state, not only for their more physical state too, if that's okay?
Yes, absolutely. I tell all of my patients, especially my, newly retirees, that it's all about, staying active and staying busy. When you look at people, genetics, yes, plays a huge role in how long we will live, but for a lot of people, if you look at their family members, if you look at them and how busy and active they've kept themselves later in life, that is the people that have very few medical problems and have very few medications. And, so it's tremendously important, to stay active, keep a routine, obviously eating a well-balanced diet, getting regular activity, even if it's just walking or swimming or biking, all of that helps to not only improve our mental health, but
That's
our
right.
physical health as well.
It's a circle.
Yes,
Yeah.
exactly.
Reading helps. Learning a new language. I learned a new language during the pandemic because I was bored to death.
What language?
None of your business. But and puzzles and games and cards,
Yes.
or even those types of things. Candy Crush, for God's sake.
Candy Crush.
But it is important
Yes.
to use your thinking skills and your problem solving skills and stuff like that. So it is a balance. It's not just eating right and exercising. It's also staying active and having social interaction and doing things for yourself as well, listening to a book if not reading. So
Exactly.
it's all good information. Thank you so much.
I'm glad you touched upon that, because we were always talking about a lot of the different things with our last, like I said, doctors, but what about the mental health? What about the mental side and the interaction with their family members? A lot of the times that was really a problem with the isolation, especially with seniors and their overall physical ability to talk and socialize. I'm sure that's been a really big problem. But now you feel like now things are opening up here now and then.
Yes.
That's kind of changing the tide.
Yes, absolutely. Obviously our older seniors, they want to see their family members, their children, their grandchildren, that's part of what keeps them going. And of course, when they haven't been able to visit them, then it's going to really start to affect, their mental and physical well-being. Right. And, just trying to keep them positive and looking forward to the future and, planning little things here and there.
Goals are good. Something to look forward to.
Short-term goals that are easily attainable. That's what, builds confidence and, can keep them going. And because like you said, we have a lot of seniors who isolate, voluntarily and some involuntarily. And some of that can be a wide range of things. Not only because of the pandemic, but also we have a lot of seniors that are very hearing impaired, sometimes vision impaired, or don't have, any means of transportation.
Right.
So, they end up getting more isolated than most.
Right.
And so we have a lot of services here at Optum with Dispatch Health and scheduling rides through their insurance companies so that we can try to ensure that we can get them into the office. Because that should never be a barrier for us. We should be able to see them and
right when you need to.
Exactly, and I think the patients feel better overall. They feel like they're getting more out of their appointment if it's in person versus just a phone call. And it's their time sometimes to socialize. It's the only time if they're getting out and about. So
right, it's to go to the doctors. So that's just as important.
Yeah.
So.
And a lot of it is observation. A lot of the times when we see someone, especially a senior, it's observing the way that they walk, the way that they talk, and what are they kind of giving off as far as, do they seem depressed? Are they unkempt? Are they not taking care of themselves?
Right. I didn't think about that.
Yeah, there's a lot you can tell, just sitting and talking with a person. So it's very important, to keep seeing your doctor routinely so that we can pick up on these things when things change.
Great information. Thank you so much for being with us today. We appreciate it.
Yes.
Always a pleasure to be in the Optum offices. Hey, I want to let you guys know that Optum is actually hosting a live Facebook stream on Wednesday, July 21st at 4 o'clock. It's Motown Summer Magic, and it's going to have a host of Thomas McCleary, who is one of the founding members of the Commodores, if you remember that. So check it out. We'll put the information here, and we'll also have it on our Facebook page, which is the Healthcare Support Network of Tampa Bay, if you want to check it out.
Thank you, Dr. Donald, and thank you too. I hope you enjoyed the video, and we're looking forward to providing you, our seniors, with more information that matters to you most. Thank you for joining us. If you'd like a free monthly subscription to Senior Life Publications mailed to you directly, please contact me. My name is David Moss. Again, I'm the publisher of Senior Life Publications in the Tampa Bay market. My phone number is 727-430-5180, or you can always email me at dmoss@seniorlifepublications.com. And don't forget to like and video and hit that subscribe button and ring that bell for us so to be notified of other upcoming podcasts in the future. Thank you for joining us again, and have a great day.
Bye, guys.